Hello, Balanced Mamas, and welcome to the Balanced Mama Project Radio. Today, we're going to be chatting a bit more about how virtual pelvic health care, especially when it comes to maternal health, is changing the way moms recover. And so you are here with Dr. Val.
Hello.
And you are here with Dr. Say. And so, at least food for thought as we kick off. What if getting support during your motherhood journey didn't require loading your baby into the car, it didn't require finding childcare, you didn't have to sit in traffic, you didn't have to get everything together, get your snack bag, get your goodies. You didn't have to do all of that.
I think that would be amazing. That would actually be amazing. I feel for this population in general because there's so many appointments to attend to, not only for self but for baby, and it takes a lot of effort to do that. And so to get baby out of the house, to make sure you have, like you said, snack bag, the bottles of milk, everything. And so I love that virtual care is on the rise for moms. It's really important because it can be really difficult to prioritize appointments for self when you are caring for a whole human. So I'm excited to get into this topic.
Yes. If you are listening and you're like, what is virtual care going to do for me? Know that we've heard this and many times before. And it's kind of funny, even looking back, I think the COVID time period allowed virtual care to kick off more, especially in the PT space. And even during that time, I learned how much you can do in the virtual care space. Because I know I've seen folks for urine leaks, for postpartum fitness recovery, even for like menopause care, prenatal care. Like there's a wide spectrum of concerns that you can see people for virtually. And it doesn't mean, no, you're not going to exercise. One of my clients was like, yeah, I didn't think I was going to have to move. It is still physical therapy.
Yep.
And so, yeah.
Still going to move.
Yes,
That's part of it.
Moving is typically key. But some of the same observations that we do in the clinic setting, we would still do even on virtual care. Are we looking at posture? Are we looking at the way you lift? Are we looking at the way you bend? And it's especially nice to see people in their daily life. And in their comfortable setting. And so when we talk about virtual care, it's really crazy how it's changed access for folks. And so...
Yeah. When we think about access too, we're thinking about transportation barriers. So it's not only, a lot of times it's not only that the mom is needing to get up and out and find transportation. Maybe it's a one-car household and the other partner is back at work or whatever the case may be. Maybe it's that now you have to think about the car seat, and it's not as simple as getting in an Uber or getting in a taxi or getting on the public transportation. Sometimes there are transportation barriers to consider. A lack of time. A lot of times, especially with newborns, there's you're on a schedule. So you're like, all right, nap time's at this time, feeding's at this time, I got a pump. How am I going to do all of those things and actually physically go in? Also, even just remembering appointments in general. Like, it's one thing to remember an appointment and be like, oh, let me just open my laptop or open my computer or turn on my phone and hop on the call. It's another thing to remember an appointment and then remember you have to drive there and get ready to go. Then we're really looking at having to reschedule, right? And then it's going. Then you go into having some exhaustion and feeling overwhelmed, and sometimes it's really like the simplest, or the hardest part, I would say, of healing is actually just getting to the appointment itself. And so I want to dive into what virtual pelvic health coaching looks like, which is what we do. But I want to kind of dispel those myths that virtual care is not as effective, or, how am I going to get help if you're just looking at me on a screen? Dr. Sarah, do you want to talk a little bit more about, what do we do? What do we do?
Yes. I've actually seen a lot of value even in that first visit of virtual care. A lot of times in the pelvic health space, the maternal health space, we have to have a conversation about what does your life look like? And so what does your day-to-day look like? What are the pain points? Physical pain, general movement struggles, what's causing the urinary issues, bowel issues, sexual function issues. What are those things that are going on? And we like to get a really detailed picture. And so it is a lot of talking back and forth to understand where you are, and then talking back and forth to understand where you have to go. I don't think people realize how many behavioral factors. So even from that first conversation, when it's like, oh, are you hydrating during the day? Well, what time are you hydrating? Well, what are you drinking? Well, what's happening at nighttime? Are you peeing every time you go to nurse tiny one? And so a lot of these behavioral things, education is a key part of doing physical therapy.
Even thinking about like toileting, right? So are we squatting to toilet, or are we sitting down? How long are we sitting on the toilet? And what is happening when we're on the toilet? Are we straining? What does it look like? What does it sound like? There are a lot of different questions that we can talk through before we even get to anything hands-on per se.
Yes, and even some of that is going to address, like, even when we talk about nursing, feeding positions, different things like that. A lot of times talking through it and then seeing you in your home environment. When we talk about movement assessments, what better place to see you than where you already live in?
Where you're comfortable, where you're relaxed. A lot of times when we even assess individuals virtually, we can tell that they're already in their relaxed environment. So then when we ask, where are you feeding, or what does that look like? We can actually see, oh, you're feeding in this particular chair. Okay, so go ahead and sit in that chair. Let me see what that looks like. Or, oh, I'm having some back pain when I'm laying down in bed. Go ahead and hop on the bed. Let me see what that looks like. I'm, feeling uncomfortable when I'm carrying my baby up the steps. Go ahead and walk up the steps. Let me see what that looks like, right? So we can assess those things by looking at you in your own space.
It is. It's definitely having you're having someone with a trained eye for this look at you in your space. Because there's nothing like trying to re-simulate what's going on in your house in the clinic. Where I'm like, let me make your fake baby. Okay, now show me what height your nursery might be. Instead of just watching you in your environment next to your actual. And I was like, oh, that's where you put tiny one.
Exactly.
Oh, okay, that's where floor play goes.
Yes.
And even when we talk about posture, that's something we observe. When we talk about breathing, that's something we look at. It's like, yes, in some cases, I may put my hands on, but there's so much to be said about, well, what do you look like doing this activity, and how can we make the adjustment?
Yeah, and that's when it becomes really sustainable, because it locks into your head as we're coaching you, as we're talking to you about it in real time. Then it locks into your head when you're doing it when we're not there, and you can be like, oh, let me make this adjustment right now in this moment. So the emphasis on the functional activity is really helpful, because then you can translate that when we're not there.
Yeah, into your daily life.
Into your daily life, as opposed to trying to translate an exercise into your daily life. And so I want to highlight all of these benefits that we're talking about. And so we know that it helps with accessibility, reducing stress, being in your real life environment is helpful for you and your relaxation. It helps with consistency. And just feeling emotionally safe and comfortable. So to go back to the first one, accessibility, when we focus on virtual care and when we're explaining what it is and how it's helpful, we also really want to touch on those populations that it's most helpful for, that we've seen. One, rural populations. Anyone who is in a healthcare desert, anyone who is in an area where there is lack of access to care for whatever reasons. Virtual care is one of those things that, like we were saying in the beginning, started booming in the pandemic and has stayed for very valid reasons, and that's to make sure that everyone can receive care. Anyone who is busy, a busy professional. I know that we've had some clients who are like, in between meetings, I can see you, and we're happy to fit in between those meetings. Any families who are abroad, or anyone who is at home managing the home and wants to be sure that they are able to continue managing the home and staying on top of all the things, but want to fit in a session here or there. Super helpful there as well. And just any specialists are not really around or in the area, super helpful. So accessibility, major benefit. And then we've got reduction of stress too.
Yes, I love that you laid out who it is most helpful for, because I think a lot of people find themselves in those categories but don't necessarily think of, oh yeah, that would be for me, or that could be for me. And I'm like, no, let's start thinking about different ways to kind of get things in versus pushing them off. And pushing things off because of the overwhelm, because of the distance, because you got to watch the kitties. And so, circling back, yes, when we talk about stress reduction, no commute. Y'all, I drive 45, 50 minutes one direction on Monday, Tuesday, Thursday, Friday, and then I drive an hour and a half back. When I tell you, if I had to go to an appointment and it took me 45 minutes to go each way, I will probably have less appointments. And even when we're talking, I need this, it's like, I need somewhere closer or more convenient. So no commute. How much stress is relieved by gaining an hour back, an hour and a half, 2 hours back of your time, because all you have to do is sit up, make sure you're dressed, and then log on. There's no waiting rooms. You don't have to worry about anybody coughing next to you. You don't have to worry about finding the location, standing in line, whether the receptionist is nice or not. The main thing that matters at this point is if you like the practitioner you're working with, and are you progressing towards your goals.
That's a fact. And I mean, honestly, and so, okay, we've got the reduction of the stress. Also, that we already talked about how in the real life environment, it's just easier for us to see what's going on with you, and we can see how you're moving. But then also consistency. I can't express enough the importance of the consistency piece. If you are able to attend sessions regularly, then you're able to see results. And that's what it's all about, is you meeting your goals. And people are more likely to attend when you are able to just, again, log on and be seen by your provider. And it's easier to integrate everything into those routines, as we were talking about before, for sure.
That's true. I was going to say, I know a lot of people talk about accountability, and knowing that next session is coming up, and it was like, oh, they told me to work on what? Oh, yeah, let me start doing that. Because usually, I know from our perspective, we're trying to figure out, well, what's going to work within your day-to-day life routine, what's feasible. So typically, we've already had the conversation of if it's feasible. So then it's just, so you're going to do it or you're not going to do it? Is now the question. And so after we have visit 1, it's like, okay, visit 2 is coming up. Did you get a chance to work on that? Well, how did it feel? Well, what went well? Was it easy? Was it hard to incorporate? Do we need to modify? And so the consistency is big. And I think that emotional safety and comfort, knowing the person is working with you, working toward getting your goals done, it can be less intimidating virtually too. It definitely can.
Yeah, because you're not...
It's scary.
Yeah, you're not... it's less of the white coat syndrome a little bit, and you're not in that sterile environment with all of the... what do they call it? The... Not LED lights, but like those fluorescent lights. Yeah. Yes. As much as we can try to make the clinic space comfortable, there's nothing like being in your own space.
Yes, less stressful. You can move the way you want to move in your home space.
So I want to be clear too that virtual care is for a lot of people, and more people than they might think. And at the same time, it does not replace all in-person care and in-person medicine. So we want to be very, very clear that it is great for improving access. It's great for creating that consistency of going to visits and actually attending. It's great for the ability to provide the education that we need to in sessions. It's wonderful for reducing the barriers to actually getting to those appointments. And it's great for promoting that feeling of comfort and safety and really addressing the whole person.
Yes.
At the same time, we are not opposed to saying, hey, this particular situation may be best addressed in person.
That's correct.
And we will definitely let you know. And any great virtual care coach will let you know those things, so that you can get the appropriate care as needed. But just know, people, that there are so many benefits to virtual care, and it's important that that is expressed. We want to get that message out there.
Yes. Even exercises. We can ask where you're feeling them. Talk about where you're supposed to feel them. Tell you how to adjust. Those things can be done virtually as well. Thank you for doing the rundown. If you have not tried virtual care, this year might indeed be your year. I know I love my virtual visits.
Oh, yes. I'm here for it. When the provider says, oh, I can see you for a telehealth, I'm like, exactly.
Say less.
Because I will hop on that quick, fast, and in a hurry. But all right, well, we love to talk to you guys. We love to hear from you. Please leave us comments. Feel free to set up a call with us if you're curious and you want to know more. We're happy to chat. But in the meantime, stay balanced, mamas.